Colorectal cancer is the second highest cause of cancer-related death in Australia. But if it's detected early, it's also one of the most curable. So imagine a situation that there was a blood test that you could take to detect whether you have a risk of having cancer. Well, that's exactly what Rhythm's trying to do, to develop a blood test for global distribution based on patented technology developed by the CSIRO over 13 years of research. The test is based on the detection of proteins that are in the blood that are indicative of a risk of bowel cancer. The risk of developing colorectal cancer increases as we get older and increases dramatically after age 50. So people above the age of 50, between the ages of 50 and 75, are encouraged to participate in bowel cancer screening in our target jurisdictions of Australia, the European Union and the United States. And so that represents 250 million people. Now, some of those people do the right thing and they do screen for cancer via fecal tests and via colonoscopy, but that leaves still 130 million people untested, and they're the target market for our technology. We're not alone in thinking that bowel cancer is an important target for diagnosis. There are new technologies that are being developed around genomics, etc. But our test is a simple test based on a limited number of biomarkers, which has an impact on controlled costs of goods. It is also a simple test that can run on existing infrastructure in most diagnostic laboratories. It's an antibody-based test, and these have been around for about 30 years. The test itself is at least as good as the current fecal immune test, which is used widely, but this test is not particularly popular with people who are asked to, invited to screen. And so we're hoping that our test will enhance the number of people participating in screening. I'm just joining Rhythm as the Managing Director after spending a long time in CSIRO. And over the last 15 years there, I've headed up a portfolio of projects in the area of colorectal cancer, early detection, and diet and lifestyle approaches to its prevention. So for me, this is an opportunity to take some technology that we've developed from innovation stage to a marketable prospect, and then to take that through to the marketplace where it can actually save lives. I'm supported by a very qualified board chaired by Shane Tanner. Shane is chairman of two very successful ASX-listed companies currently, Paragon Care and Zenitas Healthcare. He's also a previous CEO of Symbion and CFO of Main Pharma. Lou Panaccio is also a director of Sonic Healthcare currently, and has also been a prior CEO of Melbourne Pathology. Dave White, located in the United States, works with Planet Innovation and has a track record of taking new technologies developed in Australia and successfully marketing them in the United States. We're seeking to raise $9 million, and the key goal that we have at the end of that period of time, we expect it to last us about 2 to 2.5 years, is to have lodged an application for regulatory approval to sell our diagnostic test in the European Union. What are the steps then that lead up to that? We have to do a major clinical trial with about 1,000 individuals at normal risk of developing bowel cancer. To do that test, we need to be using the test in its final form. So we also have some further development work on that to identify and develop our own test systems and to be able to make those robust and transfer that technology to contract manufacturers.